I called, of course, and I said, I've got a referral, and they said, we're sending your referral right away to Lynchburg Pulmonology. And they said, oh, we got your referral, and our first appointment will be February. And this was in June, early part of July.
Were you surprised by how long it was going to take for you?
I was shocked.
Tonight at 6, we introduced you to that woman who was told the wait to see a specialist in Lynchburg was 8 months. So instead, she called UVA in Charlottesville and got in just a couple of weeks. Doctor shortages are stretching healthcare systems thin across Virginia, leaving many of you waiting for care. Only on ABC 13, Danner Evans shows us how Centra is getting creative to get patients in their doors sooner.
The system is broken. We don't have enough doctors to meet demand. Burnout, retirement issues, recruitment, and a growing aging patient population are taxing our healthcare systems. Patients are paying the price with longer wait times.
I guess the big question that we're trying to answer here is, where are all the doctors? And that's not an easy question to answer.
What I will say from a Lynchburg perspective is everyone is asking the same question. There is no community in America that has more than they could use.
Chief Operating Officer Sloan Albert says Centra, like many others, is getting creative to fix the problem. According to a recent Virginia Commonwealth University health study, in 2019, there were 5,899 primary care doctors in the Commonwealth. In 2024, that number rose a little to 5,941. Researchers tell me we still need about 40% more doctors to meet the current patient demand. Centra uses a community assessment to figure out staffing shortages they need to address.
That's how we know we need 44 more primary care physicians in the region. And some of it is response to retirements, but a lot of it is response to just the number of people in our population who need care.
Centra recruits primary care physicians right out of its own residency program.
This is a family medicine program. It's a 3-year program.
Dr. Ashley Chisholm graduated from Liberty University's College of Osteopathic Medicine and matched with Centra's family medicine program.
I knew, like, for me, it would fulfill me to stay here and be able to work with the same patient population I got to as a medical student, and kind of give back to the community that helped make me a doctor.
I think, sometimes it's hard to recruit to more rural areas like this. Why do you think that is?
I think part of it is it is the unknown. So when me and my husband, we actually moved from Seattle out here in 2020, it was a big question mark. Originally, our plan was to move back because that's where our family is from, but we fell in love with the area once we had the time to really stay here and see the community.
Dr. Heidi Bowden teaches residents like Chisholm. She believes Centra's program is beefing up the number of doctors serving our area.
Every year there's 9 new residents that start here in Lynchburg, and that is a large number of primary care physician opportunities.
Centra also embraced the concept of care teams in order to combat dwindling physician numbers. It looks like this. A physician oversees a team of physician assistants and certified nurse practitioners. It's a model most healthcare systems are adopting across the U.S., according to Albert.
Do you think you're still getting the same level of care if you're not seeing a physician every time?
I would say that I was a late acceptor of the advanced practice professionals. I do, and I've been working with physicians for 30 years. So, I just wasn't sure, but I can tell you that I get more time to spend with the nurse practitioner or the PA than I normally would with a physician.
You said primary care is tough to recruit. Tell me what other areas.
I hope you have enough time. So we are seeing it in endocrinology is hard to recruit, urology hard to recruit, generalist positions.
You may still have to wait to see a specialist in this area or shop around to a nearby health system to get in sooner.
We do have arrangements with several tertiary care hospitals in Richmond and Charlottesville and Roanoke where if we don't have that care available, we are able to get the patients in quickly.
Centra also introduced AI to help doctors cut down on office time transcribing. Additionally, they believe that their new facility on Langern Road is going to streamline patient care for you. They consolidated many of the specialists under one roof to create a more one-stop shop for patients, especially helpful to those of you
who have to travel to Lynchburg for care. Back to you.